I'm Matt Willis, Public Health Officer with the COVID-19 update for June 17th. Today is an exciting day for us in Marin. As I speak, the CDC is meeting to review the FDA's recommendation from Wednesday to authorize COVID-19 vaccines for children aged 6 months to 5 years. Up until now, about 8,000 of our residents, everyone under age 5, has been excluded from the protection of vaccines because they were just too young and not eligible. But that's about to change. As we anticipate the green light to finally vaccinate our youngest residents, starting next week, I'd like to address the 4 most common questions that we've been getting. The first is what products are being authorized and how do they differ? The 2 vaccines up for authorizations are Moderna and Pfizer, so they're familiar as the same vaccines over 90% of us have received in Marin, but slightly different doses and timing. In children aged 6 months to 5 years, Moderna will offer 2 shots spaced 1 month apart, at 1/4 of the adult dose. The Pfizer vaccine will be 3 shots over 11 weeks, 2 in 3 weeks, and a third 8 weeks later, for children aged 6 months through 4 years, at 1/10 of the adult dose. The Moderna series was about 40 to 50% effective at preventing COVID-19 infection. Pfizer's 3-dose series was about 80% effective, although that was based on a smaller number of children who received that 3rd dose. Kids will at least somewhat be protected after getting the 2nd dose of Pfizer at that 3-week interval. And remember, a vaccine that is 50% effective means that your risk is cut in half, that is by 50%, compared to an unvaccinated person. The next common question we're getting is the side effects of the vaccines in young kids. The data so far suggests that the side effects are milder than they were in older kids, probably because of the significantly lower dose. Side effects in infants and toddlers included fussiness, sleepiness, and pain at the injection site, which is not surprising. No children in the studies developed any heart issues like myocarditis. The next question we're hearing is another good one, and that is, should I vaccinate my young child at all, since no kids under age 5 have died from COVID-19 in Marin County, and symptoms are often mild in young kids. It's important to remember that less risk from COVID-19 in young kids doesn't mean no risk. In fact, more than 500 children age 5 and under have died from COVID-19 in the U.S., and it's one of the top 10 causes of death nationally. COVID-related hospitalizations are higher in children age 4 and younger compared to older kids, and often occur in people with no known risk factors. Vaccines are our most effective tool to prevent severe forms of COVID-19 in all age groups. Another important factor for us in Marin is that we're currently experiencing high rates of community transmission. In the past month, 113 Marin children aged 4 and younger have been reported to have been infected, and we know that's a significant underestimate. Vaccines will make every setting where kids gather together safer, for kids and adults, including childcare settings, playdates, parties, and summer camps. Our childcare providers have been heroic in stepping up every day to take care of our kids, knowing none of those kids were vaccinated. We should take their health into account the way we have for teachers. Over 80% of our school-age kids aged 5 to 11 are fully vaccinated, and that's helped us keep schools open and safe. Finally, I'd like to answer how vaccines will be rolled out for our young kids in Marin. Rather than large public mass vaccination sites run by public health, where so many of us have been vaccinated over the past 2 years, our young kids will be mainly vaccinated by their pediatricians. Children in their first 5 years are regularly visiting their pediatrician, and vaccines are a routine part of these visits, following the schedules for vaccines they'll need before starting kindergarten, including measles, whooping cough, and other serious vaccine-preventable diseases. The COVID-19 vaccine can be given at the same visit as these other important vaccines. Public Health will be partnering with pediatric practices across Marin to meet the demand for vaccines by sending staff and other supports. Almost half of our 8,000 newly eligible kids are Kaiser members, and our Kaiser pediatricians are eager to protect their youngest members. So the message to parents is to reach out to your pediatrician to schedule an appointment and talk through any questions you might have. In Marin, we've known that vaccines are our safest and best path through this pandemic, and over 90% of us are fully vaccinated. starting next week, we can start to close the last major gap in our vaccine coverage as a community, which will leave us all much better protected. Thank you for doing your part.